Perinatal Bereavement Conference in 2026 in New Orleans. I'm a neonatologist, pediatric palliative care provider, and the neonatal lead for the Fetal Care Center at Connecticut Children's. I primarily work at the Level 4 NICU and Fetal Care Center and have a true passion for caring for pregnant individuals and neonates with various complex diagnoses. In these roles, I spend a great deal of time counseling families with various complex prenatal diagnoses and really partner with them to create personalized birth plans and care strategies. My research is focused on improving outcomes for neonates with complex diagnoses, neonatal perinatal palliative care, neonatal pain management, the experience of bereaved parents, and communication and counseling and shared decision making. In the plenary session, I'll be giving a talk titled Complex Fetal Diagnoses, Current Landscape, Constraints, and Barriers to Equitable Care. In that session, I will be using the example of fetal kidney failure to really highlight the ethical considerations, complexity of care options, and barriers to equitable care after a serious fetal diagnosis is made. The complex discussions and nuances of the discussions about the potential care paths often include melding the medical information with the family's views, values, goals, hopes, and fears. Many of the factors that influence decisions about the care paths are innate to the individual or the situation. It's also important to really consider external factors that may impact the options that are available to a family or the decisions they make about the options. These include geographic location, economic implications, individual provider bias, institutional policies, and the medical legal climate. As providers, we don't always like to think about these factors impacting the care options, but it's a reality for many of our families and something we must consider. We also must consider the impact of the various care options on the pregnant individual, family, fetus, neonate, and society. In that context, I hope to discuss the ethical considerations for fetal and neonatal interventions that may change a lethal diagnosis to a complex chronic disease, really delve into the external factors that may limit the care options available, discuss counseling challenges with complex fetal and neonatal diagnoses, and in that context, explain the importance of palliative care. Later in the day, I'll build upon some of the topics I highlight in that plenary session to host a session on navigating goals of care in the neonatal perinatal period. In that session, I really hope to introduce what neonatal perinatal palliative care is, give a little bit of a background, explain the importance of neonatal perinatal palliative care for families facing complex fetal diagnoses, review how to navigate fetal or neonatal goals of care, hopefully give you some tools on how to have these nuanced conversations with families, really map out birth planning, and discuss how to effectively communicate goals of care, conceptualize and document that birth planning process, and really integrate those paradigms of neonatal perinatal palliative care to provide complete counseling and care for our families. I hope these sessions will lead to some fruitful discussions and that I provide you with some strategies to really support families as they're navigating their care journey. I can't wait to see everyone in New Orleans, connect with some colleagues and dear friends, meet colleagues who are equally interested and passionate about the important work we're doing, and really learn from all of the amazing people at the conference. Come join me for a fabulous conference, good conversation, wonderful food, and an amazing atmosphere. See you in New Orleans.